Yes, so we're now going to hand back to actually the directors of the Mathematics Institute and our two organizers, Michael Lee and Jacques Belair, who will help us close the session. Thank you.
Okay, thanks, Sarah. I think I would like to give the floor first to Michael and Jacques, so that they can share their reflections on the seminar as a whole. And then I will ask the directors to speak on their points of view.
Yeah, we agreed Jacques will do that.
So I think that after quite a diverse and really fascinating number of talks and discussions, we reached a conclusion that there are a number of challenges and very many different aspects that can be incorporated. This the insight of modeling is modeling of the insight also. And I think what came out significantly is that many aspects can be incorporated in more realistic modeling. And as someone mentioned, if you don't, for example, do not incorporate social behavior in your models, well, you're doing it, but you're doing it the wrong way. So I would paraphrase that by saying that those who ignore social behavior and social sciences do it at their own peril. So I think the main lesson I would get is that there's a need for a new perspective, new collaborations, outreaching, and understanding one another. So the other lesson would be communications between modelers, technical aspects, and decision makers, and understanding the other's point of view and how can that be incorporated in the modeling. Small scale, large scale, and the global picture, different time scales. This was quite evident from the interventions. The same models, the models you use for daily forecasting may not be the right one for monthly forecasting, and it's definitely not the right one for yearly forecasting. So I think there's lots of new directions to incorporate in the modeling, and sometimes it's a question of reaching out and learning what's been done in subsections of the scientific enterprise that we're not so aware of. And so this is a humility, I think, in some extent, to incorporate what's being done in communities that we don't know much. And so there's a good thing and a bad thing. The good thing is there are many problems and opportunities, and the bad thing is there are many problems and opportunities. So, Michael.
Oh, thanks, Jacques. Yeah, I'm very thrilled. This is much more than I anticipated for the kind of talks and the discussions. I just felt myself learned so much myself. And I hope everyone have their own takeaways from the workshop. And we were very really quite proud that the public health agencies from Teresa Tan, Dr. Tan, and others have really said that modelings have contributed very positively to the COVID-19 public health decisions. So we should keep that up. And then at the same time, there are many challenges in modeling so that we can do better modeling, especially I remember Jianhong has mentioned a few times that how can model predictions eventually be accepted as evidence. And from Dr. Carolyn Charles' talk, we've seen that these pharmaceutical modelings has achieved that, right? They basically accepted by the pharmaceutical industry so that it can be part of the decision making for dosage, for clinical trials. And so how can we achieve that? And so maybe there are many things the epidemic modeling community have to think about what do we have to do ourselves in order to achieve that. And also, because this is an endemic COVID kind of workshop, and to talk about endemic, endemicity, I guess we have an idea that by that time, we shouldn't expect any strict kind of public health restrictions. And then, or if you think about a seasonal flu, the severity, one side is impacted by the pathogenity, but also impacted by social human behavior. How long it lasts a wave and how severe it lasts. And human behavior will be the main driver, and also immunity level, and also pharmaceutical interventions, effective drugs to protect the vulnerable population. So these are really all touched. We learned so much on these, and we would just have to sit down and start to improve our models. Thanks. Yeah. Go ahead.
Can I finish with one analogy? We've heard stated by very many people that we're building the plane as we're flying it. I think looking forward in terms of preparedness for endemicity or another pandemic event, one should think of having a fire station built before the fire shows up in the house. So when your house is on fire is not the time to hire firemen and set up fire engines and having water supply brought. You have to do it in advance. And one can think of capacity building as an insurance policy. You're happy that you have not contacted your insurance company, that you've paid your insurance premium and not gotten any benefit for it because nothing bad has happened, but you still paid your premium. So I think one of the challenges is to be in a situation that would make mathematical modeling of infectious diseases as acceptable by the end users as now pharmacometrics has been accepted as in silico modeling for the pharmaceutical industry. So I would say that's the first order of business that we face as a community. And I think we can turn over to the Institute directors now.
Okay, very, very good. Thank you, Jacques and Michael. Both of you have done a fantastic job. You and also Seahra and Jianhong put together something I think that we can all be proud of, and we'll spend the next little while reviewing what we've heard and learning from it. Now, as you know, the Math for Public Health project is a joint initiative of the four mathematics research institutes. And so I would like to ask my fellow directors to join here and share their views and their comments. I'm just going to go from in one direction. So I'll start with Jayadev in Vancouver. I presume you're in Vancouver, so not in this online age where you are, but you're representing Jayadev. Athreya is the director of the Pacific Institute for Mathematical Sciences, which is located in Vancouver. Jayadev.
Thank you. So PIMS, as you heard, is based in Western Canada. We're a consortium across Western Canada, the provinces of British Columbia, Alberta, Manitoba, and Saskatchewan, and also in the United States at the University of Washington. We're very, I was tremendously impressed by this fantastic workshop, and the Math for Public Health program is, I think, a critical part of building the infrastructure. I want to build on that analogy that we just heard about, building insurance or building that fire station. You don't always want to be reacting to events. You have to be preparing for events. A couple of remarks is that this is an investment that's been made. It's an investment that needs to continue. We are in the middle of training a generation of mathematical scientists to be nimble, to be able to model, to do these kinds of modeling problems. And if it's only 2 years of investment, that's a difficult thing to sustain. However, if it's sustained investment, then we have generations of people mentoring, vertical integration, you have faculty mentoring, postdocs mentoring students. And that's something that is really necessary to build that kind of sustained infrastructure to address the challenges that infectious diseases, even when they become endemic, cause, right? Endemic doesn't mean, as you well know, doesn't mean harmless. Tuberculosis kills 1.5 million people a year in the world, 1 million people a year, close to, several 100,000 people a year in India in particular. But it's endemic diseases are serious, and we still need to model. We still need to have interdisciplinary tools, mathematicians, scientists, social scientists, biologists, and initiatives like Math for Public Health and the other EIDM initiatives, such as CAN mode, are crucial for this, for building that insurance and for building that fire station to keep us all safer and healthier. So I want to thank Kumar and Fields and the other institutes, CRM and AARMS, for working together on this incredible initiative. And I hope that it continues for a long time. Thank you,
Jayadev. Next, I'll call on Octav Cornea, Director of the Centre de Recherches Mathématiques in Montreal.
So, hello, I'm very happy to be here. So, the Centre de Recherches Mathématiques is a math institute in Quebec, in Montreal. And first, I want to thank the organizers of this meeting for this great event. And of course, special thanks are to Kumar and the Fields Institute, who did a wonderful job of putting all of this together. And it was, as always, a great pleasure to work with them. I don't know if we can applaud a little bit, or this was happening before this, but okay, I'll just do like that. This was really remarkable, and we live in a very complex and connected world, and as a mathematician, I expect that more and more of our refined tools will be needed to understand and anticipate the evolution surrounding us, and this will certainly happen in a variety of challenges, some related to the pandemic. Hopefully this one will end soon, but also related to climate change and other issues. And one of the lessons is that I think of the current pandemic is that mathematical understanding and modeling have a strategic value. And I hope that this successful network that relates our institutes and also receives the support of NSERC will continue and will help us deal with whatever is coming. And so thanks again to everyone, and I'll pass to the next of us 3 or 4 here.
Thanks, Octav. Now I'll introduce Sanjeev, Seahra, Director of the Atlantic Association for Research in Mathematical Sciences in Fredericton.
Hi there. Thanks very much, Kumar, and thanks to all my fellow directors, all the speakers, all the participants. This has been a fantastic workshop. I've really got to congratulate the teams at Fields and all the organizers of this event. I've actually managed to attend most of it, and it's been very informative, very, very interesting. And I'd also like to congratulate the team for putting together this great Mathematics for Public Health network. It's truly remarkable. We do live in remarkable times for mathematical sciences. I mean, we kind of live in these times where we can draw a line between a bit of Python code or R code and the restaurant down the street shutting down. This is crazy. These are unique times for the mathematical sciences. We're very much in the public eye right now, and I think the public might be realizing, and the decisions makers might be realizing, the utility of the mathematical sciences. But when this goes away, when we get more endemic, I mean, the mathematical sciences are still central. We might not be quite as much in the spotlight, but we're still there, and we're still central to everything that's going on. So I agree with everybody. This needs to continue, and I really think the structure for Mathematics for Public Health, coupled with the structure of the network of Canadian mathematical institutes, it makes a lot of sense. It provides a framework for people from coast to coast to get together and learn from each other and form our interdisciplinary collaborations, and then go away to our respective areas and apply that in our sphere. So I know AARMS researchers for sure benefit from assembling and learning from Mathematics for Public Health events and initiatives, and then we go and we apply that in our regional areas and apply this knowledge and spread this throughout the country and help smaller communities in particular for the Atlantic region. So this is a very Canadian thing. It's a very Canadian structure. It's a federal structure, if you like. I mean, this makes sense. This is what we've got to keep doing, and this is what hopefully the federal government will realize is the right way to go forward, fostering this network, the strong regional pillars that come together to magnify our national strength. Thanks.
Good. Thanks, Sanjeev. Thanks to all of you for your comments. I will add a few more comments to what you've said. Once again, congratulations to the organizers and Jianhong and Seahra and Jacques and Michael. You did a fantastic job. I want to make a few comments both about our collaboration, about the project, and about our discipline. So the first thing is that COVID, and we've heard this several times in the seminar, is new. It was not just modeling as has been done in the past. It was new. There was new aspects to it that we had to learn about, and we had to learn in real time, while it was happening. And you have to take in many cases, you had to make guesses. You heard in the panel discussion, Peter Jr. saying you just had to estimate and take a chance in trying to figure out what was going to happen. We didn't have the luxury of doing science in the usual way. You work on something for 6 months and then you publish it, and 2 years later it comes out. And then people say, yeah, this is a good approach. We just didn't have that luxury. So we had to look at this thing, which exhibited new characteristics, and we had to do it in real time with incomplete information. And in that context, mathematicians stepped up to the plate across the country, of course, all over the world, but certainly in Canada. All of you are evidence of that. Stepped up to the plate and lent whatever ability and the insights we had, and made a difference. Made a difference from the very beginning. So that's an important thing to understand about this virus and the role that mathematicians played. And in this process, not only was the virus new, so that required us to develop new science. New science was developed during this thing. It's led to publications, of course, but I think the way health issues are viewed or dealt with in the future will be different. I mean, think, for example, even the way the vaccine was developed, there was some mathematical modeling involved in that, but that's a game changer. The speed with which it was developed and the kind of vaccine. So a lot of new science happened during COVID, and a lot of new math as well. So we saw, for example, in terms of our modeling, the role of behavior, the use of socioeconomic determinants of health. The vaccine rollout here in Ontario was largely determined by mathematical modeling, and it was changed, and it made an impact, taking into account the socioeconomic status of different parts of the province. New models were developed. I mean, there are these compartment models that we're more used to, but then models like the hurricane were born during the pandemic. That's a different way of looking at it, a purely data-driven way, which is almost agnostic to specific interventions, almost very unintuitive that it can actually yield information, and yet it does. And so there's a new tool, and that's just one example. So new science was discovered and developed. Also, we learned a little bit, and we learned a lot, but we still have a lot to learn about talking to each other. We had to sit at the same table as people who don't speak our language, and we don't speak their language, they don't speak our language. You just heard in the previous panel discussion, Andrew Morris, a very distinguished person in his field. You see, the problem is once you start saying something that even appears mathematical, it's a barrier. And then when remember we were on science table together, and if they're intimidated by the math, I was always intimidated by the polysyllabic words that they use. I can't even pronounce the names of the medicines or the drugs that they're looking at, and it just rolls off their tongue very easily. So it was a two-way thing that we had to learn. That's a lesson also that was gained during the pandemic. We sat at the same table. We started trying to understand each other's language. We started trying to communicate. So that's another important thing that happened in the pandemic. And again, we as mathematicians, we have something to contribute, but we have to be informed by what is the problem. What is the problem that's being asked? And we need to understand that in order to respond mathematically. And we did that. We made that effort to do that. We involved a broad spectrum of researchers. Some of the people here and during the workshop are seasoned modelers. They've been doing it for decades, but not all. Some are actually came into this because there was a need, and we learned on the job, so to speak, and we brought different perspectives to it. So, for example, the hurricane model is really inspired from finance. And I know there were other researchers like Tom Hurd, who he's inspired also from finance, and he developed this theory of contagion. So we brought together a broad spectrum of researchers, and we learned to use our special expertise in a way that was relevant to the crisis that was in front of us. I think that's something also to celebrate. You notice during this seminar at various times, there are lots of people attending. There's a huge public interest, public appetite. Some of these are technical people, scientific people who are on the seminar, but there was public attendance too. I know our field staff wanted to attend. I think that some of them are still in attendance. That there's that eagerness to know, and so we did that as well. We tried our best to translate our mathematical insights, our technical models into ordinary English in language that people could understand. We did it at Fields, and I'm sure the other institutes did it as well. We had a series called What the Numbers Say. We asked people to come together and explain in ordinary terms what's going on. Why? Because the public had an interest in knowing. So it's another way that we stepped up to the plate in this. The question comes, Teresa Tam was saying in her opening remarks, we're cautiously saying we're seeing light at the end of the tunnel. And I think that's probably right. We were probably on our way towards endemicity in the near future. But as Jayadev says, it's not to mean that all our problems are solved. Endemicity is still a serious thing. There's long COVID that we need to worry about. But it's a different state of affairs. It may not require the public health measures that we've been used to. But more importantly, there's something else, and some of you have already spoken about this, that in the midst of the crisis, when all eyes were upon us, everyone was forced to take this seriously. What happens when the crisis is past, or you're not hearing daily death tolls or ICUs being overwhelmed? What happens then? What happens with government attitudes? What happens with public attitudes? What happens with all of us? As several of you said, you can't say I don't need a fire department anymore, and then dismantle it. You can't. You have your fire department not only has to exist, but you have to maintain it. You can't say I have a truck there. There is a water somewhere, but I'm not maintaining it. That's no use either. It's got to be maintained. This is a message that we, all of us as directors, but everyone else in the community has to make sure that people hear, people in industry as well as in government. It's a joint effort. It's all of us together. And a message that I think certainly we will be trying to take to the federal government and the provincial government, that this cannot be a one-off. We've proved the relevance and the importance of this work that MfPH and the other networks in EIDM are doing, and there's got to be some continuous way of sustaining that. And sustaining that, and the people will see the importance of sustaining that in different ways. From one point of view, if you're a public health official, you say, I need up-to-date modelers or up-to-date people that I can count on if something happens. But from our point of view, there is ongoing science that's being discovered, as I said right at the very beginning. So it's not just a reactionary thing. I think there is there is a new kind of interdisciplinary body of knowledge that we're developing. People learning to talk to each other, and then as a result of which, creating new science. So I think there is a big role here post-pandemic for MfPH and similar networks to continue to thrive even. Not just as a fire station. Maybe the fire station analogy is valid, is interesting from one point of view, but not in another. Namely, it's not just about putting out fires. We're even in so-called peacetime. We will be building new science. We'll be developing new mathematics. So that's another thing to keep in mind. The fourth thing, which gives me a lot of joy, actually, happiness when I think about it, is the way the institutes have come together nationally. We're a formidable force. Think of it. We're spanning the entire country together, and we're like a research backbone. Now, imagine if that was well-oiled and always working together like that, then we can summon together immense resources for research on any challenge that society faces. Mention was made about climate change. In fact, that's exactly what we're working on now. We're trying to put together a national network that's going to address the mathematics of climate change. But much, much more is possible. So I think that's another thing that we discovered. We demonstrated we know how to work together. We demonstrated that we can bring huge resources and people together to create this national backbone. And I think we have to continue to do that. And that'll only serve to make each of our individual institutes stronger, but also the country a lot stronger, more resilient, and even a leader in challenges that face us, face the world. The opportunity, somebody said here that the opportunity for mathematics is we're at an unusual time. Never before has the opportunities for mathematics been so evident. The pandemic is one, climate change is another. There's so many others that mathematicians can make a significant difference, and it'll impact on the quality of life of people. So it's our turn. This is our turn, and it's time to, as we have been stepping up a little bit, as we have been making efforts, I think it's time to embrace that opportunity together and build something really fantastic and something that we could all be proud of as it happens. So those are my reflections on MfPH, this seminar on MfPH and the Institute collaborations and the future. I think I'm so happy that we were able to come together like this. Once again, hats off to all of the speakers, all of the organizers, the staff at Fields. As usual, you did a fantastic job in making sure everything runs really seamlessly. Thanks to our deputy directors, Deirdre is here. Thanks to her, and I'm sure the deputy directors at the other institutes also played a role. So thanks to all of them as well. Let's think of this as a beginning and not an end. Thanks. Thanks, everyone.